Hi, I am Dr. Jaiswal. I am a neurophysician. I am a consultant neurologist at KIMS Hospital, Kondapur. I am the head of the department of neurology there. Today, I would like to discuss something about a very common condition called vertigo. Now, vertigo basically means rotation. Now, rotation can be subjective or objective. When you say subjective vertigo, it means your head is rotating. But when you say objective vertigo, you mean the surroundings surrounding you are moving. That is, the room is moving, or the earth is spinning, or the people around you seem to be moving. So it's a feeling, right? Which is contrary to the fact. Now, what are the common causes of vertigo? Here we should understand that vertigo is related to a defect in the balancing system of the brain. So, what is the balancing system of the brain? The balancing system of the brain is mostly related or connected to the ear, inner ear, and also it has something to do with the peripheral nerves. Now, when a patient comes to us with a symptom of vertigo for the first time, we are worried because in this situation, the cause for the vertigo could be central or peripheral. So, what do you mean by central? When you say central, that means the vertigo or giddiness or dizziness which the patient is feeling is because of a problem in the brain. And when you say there is a giddiness or dizziness of peripheral origin, then it is because of the ear and its connections to the brain stem. Now, we will go into little details as to what are the causes of vertigo. The commonest cause for we should understand that 90% of the times it is a peripheral cause. That is, ear and its connection to the brain is the commonest cause for vertigo. And 10% times it is because of the central vertigo that is related to the brain stem, which is a serious condition. Now, what are the common causes? The very common causes of vertigo are common cold viruses. We all have experienced that when we develop cold, we feel dizzy in our head and we feel that we are unsteady when we are walking, our noses are blocked, our ears seem to be choked, and we feel a sensation of rotation. And mind you, when I say vertigo, I am referring to the point that there should be a condition called rotation, vertigo. Small dizziness, unsteadiness, this is a common symptom which we all experience in common febrile illnesses. A common cold or flu can cause these symptoms. The other common cause for the vertigo, especially recurrent vertigo, is head trauma. We see many patients who say, I had a road traffic accident, or I was hit by somebody on my head maybe 3 years back or 2 years back, and since then I have developed this condition called giddiness, dizziness, or vertigo. So, when you say vertigo, it is rotation. And another condition which is medical in terminology also is Meniere's disease. We will come to that in detail. Now, basically, who should I see when I get a vertigo? Now, if you are getting a dizziness for the first time you are feeling that you are having a severe rotational sensation. How do a layman recognize? Commonly, a stuffiness in the nose, stuffiness in the ear, discharge from the ear, ringing sensation in the ear, or injury, then you know that it is all the result of the acute insult on the balancing system of the inner ear. But then If these symptoms are for the first time, one has to be always careful. You should look for the associated symptoms. You don't only look for the vertigo associated symptoms, you also look for whether there is any weakness of the hand or leg, whether there is any unsteadiness of the leg or the hand, patient has difficulty in walking, or is there any problem with speech, because these associated symptoms tell us that maybe it is not just a simple vertigo related to the peripheral system, but maybe it is related to the central. So, when you have a symptom for the first time, always it is really difficult, and most of the times we see patients when they develop this symptom of vertigo, where there is a spinning sensation and they are afraid that they will fall down. They feel that their legs are up and head is down and everything around them is rotating, and they are having a severe nausea, vomiting, they are unable to sit, stand, walk, and they start vomiting. Then naturally the patient himself and the people around him, they get disturbed, because a stroke can present like this. So, not all vertigo is stroke, but stroke cannot be ruled out in all vertigos, especially the first time if you are experiencing in life, and then you are at risk, especially in the elderly patients, especially in patients who have diabetes, hypertension, and then who have already an history of stroke or a heart attack. So, these are the patients where you need to be extremely cautious and seek medical attention urgently, because we possibly need to intervene as soon as possible if it is a ischemic event or something to do with the stroke. Now, we will come to the lighter side of vertigo. If the patient has giddiness or vertigo many a times, so we all, especially 50 plus, when they have, there is history of cervical spondylosis, they say they did have neck pain. Some doctors said that their bones are all grown old, that is why they are feeling vertigo, or giddiness is related to that. A very simple way I explain to my patients is, whenever the bones in the neck, they become old or degenerate or spondylotic, the nerves which come out from the neck, which supply your arm or hand, you will get pain. And the blood vessels which start from your heart and they go to your brain, if they get affected, you will feel the vertigo. So, this is the simplest explanation. I think this is all that a common man, a layman needs to know, that the nerves when they come out, if they are being pressed, you get pain. The blood vessels which go from the heart to the brain, if they get affected, you get a rotating sensation that is called the vertigo in medical terminology, and that is related to the blood flow. Now, what do we do? What do we do? Now, if it is recurrent, on and off you have been having this for quite some time, there are few conditions which you call as benign positional vertigo. Now, it is not that all these conditions need to be innocuous or not dangerous. You have to look at the associated symptoms. So, when a patient has got vertigo, if the patient has got these symptoms for quite some time, then possibly it is a recurrent vertigo which is related to the position, and the position is related to the balancing system in the brain. So, the balancing system of the brain is the ear, inner ear especially, which is connected to the brain stem and which gives you the information, which gives the brain the information as to what is the relation of the body to the gravity. So, once this system gets affected, you feel topsy-turvy. You feel as if your legs have gone up, your head is down, you feel the tilting sensation, you feel the rotating sensation, and then in this situation, you need to do in acute situation for say for few days, you give them some medicines to subside the symptoms of giddiness, vertigo, that is a rotation, and then you start these patients on some exercises which are called the rehabilitation exercises. These are very important in patients who have got vertigo which is positional and which is recurrent, and these rehabilitative measures are going to help the patients in adapting the balancing system. They adapt the balancing system to whatever the insult it has undergone to see that the patient does not suffer from this symptom of vertigo, which looks very dangerous at the outside. Thank you so much.